Okay, great. Well, thanks very much, everybody. So this evening's speaker is Dr. Stephen Boyd. He's a professor of biomedical engineering in the Cummings School of Medicine at the U of C, performing research in the area of osteoporosis with a particular focus on bone microarchitecture and non-invasive estimation of strength. He's also director of the McCaig Institute for Bone and Joint Health and is cross-appointed in the Facility of Kinesiology and Schulich School of Engineering. He holds the Barber and Nola Retool Chair in Bone and Joint Health and the McCaig Chair in Bone and Joint Health as well. And if that's not enough, on a personal level, I've known Steve for about 10 years. I guess that's about right, isn't it? And both of us got to know each other through our involvement in the ski racing community. We've both been involved in and timed ski races, would you believe it? So on behalf of the Canadian Prairies Group of Chartered Engineers, we thank you for joining us. And on your behalf, we'll be making a donation to Operation Eyesight. So thanks very much. And over to you, Steve.
Great. Well, thanks very much, Dave. Yeah, we've spent many times talking on headsets during ski races and running around ski races. So Dave, I was going to sync my watch here to make sure I'm synced with you. Just to give me a target for time, I was kind of planning on about 30 or 40 minutes. Is that reasonable, or?
Yep, I think
I can go on forever.
Yep.
Or I can also go on less than.
And then we'll have a few minutes for questions as well at the end.
Sure. Yeah.
Perfect.
Okay. So, yeah. Thank you.
So yeah, thanks very much. So let me share my slides here. Share screen. And I hope can see my title slide now, talking about the skeleton and long duration spaceflight. Just one person to confirm that for me, so you can see that. Okay, yeah, I see some thumbs up. Great. So let me just close a couple windows here. I realized that, you know, in the introduction, I sent Dave some of those words and they start to all melt together because I hear them spoken so often. But basically what I'm really interested in is how the skeleton adapts to microgravity, to space. And so this is work that I've actually been involved in, supported by the Canadian Space Agency since 2009. And there's a whole fun story about how it was funded and everything I could tell later. But ultimately, the study has been going on, and most recent, our final measurements in the study actually happened during COVID-19, which made for a little bit of a challenge to get some of those measurements. But essentially what we've been doing is measuring the bones of astronauts before and after they spend roughly 6 months on the International Space Station. Also, just a FYI, my background is actually mechanical engineering for my PhD. And then my research area has always been in the area of biomedical. And actually, that's how I know Nigel as well. It's through biomedical engineering. I was actually a student, and I think Nigel was on a few of my committees at some point. So the first slide I have here is just a fun one that Bob Thirsk was our chancellor at the university, and he's been very interested in this research as it goes on. As a former astronaut himself, he had his flights before this study occurred, so he wasn't part of the study. But every once in a while he gives talks, and once he gave this talk and he showed this photo, and it's a photo, I don't know if you can recognize it. I hope you can see my mouse on here, but this is Calgary right here, this bright spot. And then we're going through Red Deer up north to Edmonton. And so as you come west, you can come through Canmore, Banff, Lake Louise, and then you can get into Revelstoke, or no, that would be Golden, and then this will be Revelstoke, and then you get into the Okanagan Valley. And I am from this dot right here, which is about Oliver, British Columbia, and South Okanagan. So I think it's a great photo to see all of that space in one place. But this is all taken from the International Space Station, and that's where a lot of this work was based out of. This is a picture of some of the team members. There's a lot of people involved in this research. Some of them are from my lab, like Duncan and Stephanie, Paul and Kat. And Lee, who is was a postdoc working on this project, obviously, as you can see by the hat, and she's actually wearing a jumpsuit, a major fan of space research and got really excited. She's now a faculty member in the Faculty of Kinesiology. And then others include collaborators from Germany, Martina and Anna Maria. And then from NASA, we have Sarah, who works with Scott Smith, and he's the head of nutrition at NASA, and Jean Sabonga, who's the head of bone and bone research at NASA. So they've been great to get to know on this project, and really, really helpful in making sure we get our work done. In the middle here is the scanner, and it's the whole research is based on this high resolution computed tomography system. I'll show you pictures of it later and what it can do. But basically, you put your hand or your foot in this hole here, and we can measure your bones at resolutions of about 60 micrometers. So just to give a point of reference, your hair is about 100 micrometers thick. So we can see very, very fine details of the bone structure. And that's what's really unique about it. And what's kind of fun, I'm going to try to throw some fun things into this as well, is these mission patches that you see here are associated with each mission that goes to the International Space Station. So whenever an astronaut participated in our study, we always threw a mission patch onto the scanner in reference to their flights. And they're tickled a little bit to see, oh, we thought of them and so on, which is nice. And this scanner is actually located down at Johnson Space Center in Houston. It's one of a very small handful of scanners in the world like this. It's actually a University of Calgary device, and it located permanently down in Houston. We put this big sticker on it because we don't actually use it too frequently. The number of astronauts we see is on the order of one every 2 months or so. So it sits down there not doing a lot most of the time. And we're a little afraid that NASA might forget that it's not theirs and just start using it. So it's kind of fun to make sure we got the University of Calgary nice and prominent down in Houston there. So the study that I'm going to show you, I'm going to talk a little bit about bone biology because it relates to the bone mechanics, which is the interesting part. And we use imaging to, again, get back at the bone mechanics. And the study that I'm talking about, like every project at NASA has to have a short name. And so we ended up calling it T-bone. And T-bone is for three-dimensional bone analysis. But there's actually happens to be down near Houston, a place that sells steaks called T-bone. So we've always gone there to celebrate, which is kind of fun. And the great thing about doing space research combined with imaging research is there's lots of great photos. So this is a picture of the Soyuz rocket, which would be carrying 3 astronauts typically in the capsule at the top. That up until recently was the only way astronauts could get to and from the International Space Station. Just now they're starting to use SpaceX vehicles, and Boeing, I guess, will be coming on board too, to transport astronauts from the United States instead of having to go to Russia, which is actually another story we could talk about, a little bit of a problem these days. So a little bit of background about bone. As an engineer and getting involved in biomedical engineering, I always just assumed bone was a very inert material that didn't really change much. But actually it's a highly dynamic tissue, and it can actually be affected very quickly by unloading. Here we're talking about unloading in space, but it can also happen by long-term bed rest. If somebody's really ill, they have to spend a lot of time in bed. It can even happen through joint injuries. I actually do a lot of research as well in knee injuries, and a knee injury results in changes in loading in the joint, and that can in turn affect the bones. So bone changes very rapidly, actually, and in just a few months in microgravity, you see profound changes in the bone structure. So bone loss in space is not really that new. It's been known since the space programs began, with longer duration flights, particularly, that you lose bone if you spend a lot of time in space. And with the International Space Station coming on board, the time in space is much greater. Up to a year is the maximum they've had so far. And so you start to lose substantial bone well up there. And so where you lose bone depends on which part of the skeleton you look. It turns out that bones down in the weight-bearing region of the skeleton are more affected by spaceflight than bones in the non-weight-bearing area. And that's something that we showed in our study as well. But it really depends on skeletal site. And then the important part is assuming the astronaut's coming home one day, which they all make that assumption, is that they recover once they return to Earth. And so the amount of time to recover, this is some data looking at somebody's femoral neck and their hip, in different astronauts' hip. And the time to recover to full on average is, up to 2 to 3 years before their bones are fully recovered on average. There's a lot of variability amongst people. So there's a lot of information or a lot of changes that can happen. And so then there's been a lot of work into trying to prevent bone loss. And some of the approaches that have been used are countermeasures like nutrition, making sure people are eating healthily. And that includes, for example, getting adequate vitamin D, adequate calcium intake, all those things that affect your bones. Using exercise devices, so treadmills, stationary bicycles, cycloergometer, and then what's termed ARED. And so that stands for Advanced Resistive Exercise Device. And I'll show you some examples of that a little bit later. And then there are pharmaceutical ways of doing it as well. So people who have osteoporosis on Earth would normally take a bisphosphonate to either prevent further loss or even improve their bone. And it's been explored as well, whether that can be done in astronauts. But despite all of these different countermeasures for reducing the amount of bone that's lost, which have been successful, they can't prevent bone loss in its entirety. And so that's still a major challenge. And part of the reason that's a challenge, I mean, here we're talking about the International Space Station. So it's in low Earth orbit. It's relatively close to Earth, actually. And people are up there for a maximum of 6 to 12 months. But what happens, and this is imminent now, is NASA is very seriously looking at longer duration flights. They're estimating, I don't know the exact dates, but 2025, they're hoping to start to put people into orbit around the moon on that order. It might be a bit off. And then they're also even looking further out to Mars. And in those cases, you might be up to 14 months duration in microgravity. And not only is that a problem, I mean, the skeleton is only one of the many problems that occur during space flight. When you start to move from low Earth orbits or staying close to Earth, all of a sudden the effects, as you move further away, the effects of radiation become much more substantial and more of a challenge. So nonetheless, there are many challenges with long duration space flight, for example, going to Mars, but making sure that the skeleton stays healthy is an important one. So bone is actually kind of an interesting tissue because it can be described in terms of what they call a mechanostat. So your bone receives daily loading when you're walking around, doing your daily activities. If you start to load it more, if you become very active, you can actually increase your bone to some degree. So as the amount of strain on your bone increases, you can actually have a little bit of bone, new bone forming. Normally it's, after you reach your maximum bone potential or your maximum growth, which is around age 30 or so. I hate to say it for all of us, it's all downhill from there. And so the goal is when you're young to build up as much bone as you possibly can, get healthy bones so that you can maintain it into your long life. And so if you start to have unloading, then you get at the bottom end of this mechanostat and you actually start to lose bone. And that happens naturally, but you can prevent it how fast that happens. And so this mechanostat actually plays a role in understanding how people lose bone in space. So that's talking about, the relationship between daily strains and bone. How does it actually happen? So this is the only biology slide I have. And believe me, I get myself into trouble with the biology all the time. But your bones are actually having constant turnover all through your lifetime. And so there are cells that they're called osteoclasts. They're eating away at the surface of your bones. It's happening right now. And then coming in behind them are osteoblasts, the cells that form bone. And so you've got this constant turnover, it's called, where you've got bone resorption happening, bone being eaten away, followed by new bone being laid down. And that's the way that the skeleton renews over your lifetime. And it's the way your skeleton adapts to different loading. If you became a tennis player or something like that, your bones would adapt to those new loads on the tennis swinging hand. And so that's very well known. What's more difficult to understand is how this balance of bone resorption to bone formation is controlled. And that's one of the major challenges with understanding bone loss in space. So that's the bit of the biology. And we can measure how much osteoclastic or osteoblastic activity is happening in your body by taking blood samples. And that gives an overall picture of how active your bone remodeling is. So this is all called bone remodeling. So how do we measure your bones? We use, the most basic way is to use a method called DEXA, dual X-ray absorptiometry. You lie on a bed. This is actually a photo from our lab. You lie on the bed here and this device scans you and basically gives you a calibrated X-ray. And that X-ray can measure the bone density at your hip, your forearm, your spine, or your entire body actually. So that's BMD. And that's typically what's used clinically to identify people who might have low bone mass and who might have a problem with osteoporosis, which is basically the disease of people who have low bone mass, reduced strength of bone, and the risk of a fragility fracture. So a fragility fracture is not the kind of fracture that happens when you're downhill skiing and have a big crash or hit a tree or something. That's a traumatic fracture or in a car accident. A fragility fracture is a fracture that happens that shouldn't have happened. So you trip in the kitchen and you fall over and break your hip. That is a fragility fracture. Or so it's a fall from standing height. So DEXA is a way that you can measure whether or not a person's bone density is normal, high, or low. And the problem though is that DEXA, although it's widely used clinically, the major disadvantage is you're looking at your bones in a 2D picture. And so this is actually giving you a measure of the density of your bones in two dimensions. I'm getting a phone call here. And so that density is then assumed to be related to the strength. Dense materials are stronger than less dense materials. That's the fundamental assumption. Nobody actually cares really how dense your bone is. They really care how strong your bones are. But we have to use density as a surrogate for bone strength. But there are other approaches, and that's comes down to, can we actually get a better estimation on how strong a bone is, the competence of your bone? So your bones are actually made up of a dense cortical region, so dense outer region, followed by a spongy inner region. So this is somebody's hip. It's obviously a schematic of somebody's hip. And so with age or with the development of osteoporosis or with space flight, this spongy part of your bone can actually get resorbed away and become less strong. And that's reflected by a reduction in density. And it will lead to the potential for this bone maybe to have a higher chance of fracture. So how can we do a better job than just using density to understand the structure? Well, here we show an example of a femur measured by DEXA, where we get that density estimate. And here's the same femur where we measure with the high resolution scanner that I was talking about. This is just showing a single slice, but if you can see on your screen, you can see all the fine details of the structure of the bone. And this is just one 2D slice, and I'll show you a 3D version of it. So what we do in our study is we scan these astronauts. This is David St. Jacques, who's a part of our study. And we put his wrist or his ankle in the scanner. So I have a little skeleton showing where we do the scan. So at the wrist or ankle, we can't actually scan at the hip with the scanner because the very high resolution also means that we have to keep the scanner bore small so that the radiation that we use, because it uses X-rays, is kept low. So we use these extremities as a surrogate for the bone changes. So this is an example of what comes out of it. We do a scan of, this is somebody's wrist, actually this is showing somebody's tibia here. And if I advance here, we can start to see the three-dimensional structure of their bone within it. The colors are just done artificially. We can actually identify which part is the trabecular bone, the spongy inner part, and that's colored green, and the white part is the cortical bone. And so we can measure that. And then after we get those kinds of measurements, that three-dimensional image, we can measure lots of features of the bone that describe it, like how thick is the cortex, so cortical thickness, how big are the pores, the trabecular separation. So these little pieces are called the trabeculae. How thick the trabeculae they are, how far they're spaced apart, how many of them there are, etc. This is how we characterize the bone structure. So we can tell you a lot about your bones using that device. And in fact, we can take that three-dimensional information and we can make a very efficiently convert the three-dimensional data that we capture from the scan and convert it into a finite element model. So I said my background is in mechanical engineering. So a lot of my PhD was developing finite element method for automatically converting high resolution data into these models and doing simulated compression tests. And in the end, actually, that's what we want to know. It's nice to know how thick the cortex is. It's nice to know the trabecular separation and all those kinds of features. But ultimately, we just want to know how strong the bone is. And so we've developed a process that from the time of the scan, a scan takes about 3 minutes. We can have, after the scan's done, it gets reconstructed. We can convert it into a finite element model and solve the model. And the model takes, depending on the computing, takes about 10 minutes or so to solve. And then we can get an estimate of that person's bone strength. So this is all using the Extreme CT device, with the same one I showed earlier. And as I mentioned, it uses X-rays for these measurements. So people often ask, so how bad are the X-rays that you get from it? Everybody's, of course, concerned about X-rays. And the answer is it's very, very low dose, and it's measured in sieverts. So if you had a scan, and this is the brand name of this is called, if you can read it here, Extreme CT, which is a very kind of corny name, Extreme CT, but it's also called high resolution peripheral quantitative computed tomography, if you're ever looking for a mouthful to say. But in comparison to a scan, we on Earth get daily background radiation that's on the order of 8 microsieverts. So one of these scans we often say is like spending a day in the sun in Calgary. Okay. If you take a transcontinental flight, you are exposed to solar radiation as well. It's on the order of 60 microsieverts. The astronauts who spend time on the International Space Station receive about 300 to 700 microsieverts per day of radiation. And if you went and got a CT scan of your abdomen or your hips or something like that, you'd be receiving about 10,000 microsieverts. So in comparison, it's really trivial amount of X-ray radiation. So what have people found over the years? Using DEXA, they've shown that at various parts of the spine, BMD is the acronym for bone mineral density. So basically how much bone you've got, that people are losing about 1% per month of BMD. If you move to a technique called CT, like a full body CT, the kind you'd see in the hospital, so I'm sure many of you have had scans like that, they've shown that there can be a little bit more substantial loss of bone. And then people have also used high resolution PQCT. A French woman actually has been doing some of this work in cosmonauts. The way the space program works is there's I have to put an asterisk now, as of 2 weeks ago, there's always been very good cooperation between the Americans and the Russians and the rest of the world on the ISS. I think it's a bit in jeopardy right now, which is crazy, because for the first time, when the Crimea thing happened in 2014, it almost didn't affect the space program at all. And so this is really the first time in its history where it might be affected. And so far it hasn't been, but everybody's kind of waiting. A cosmonaut is the name they give to Russian astronauts. An astronaut is the name given to anybody else. And the way the space program is defined or divided in the world is the Russians and everybody else. And so astronauts include American astronauts, Canadian astronauts, European astronauts, and Japanese. Those are the four main space programs that cooperate on the International Space Station. And so some work has been done on cosmonauts by this French group. And so we were looking at a variation of this work within our own study here. So, and that's what we call the T-bone study. So the way the study worked is before an astronaut would go up to the International Space Station, they'd be in Houston. We have our machine down there I showed you. We would fly down, we would meet them, bring them to the scanner and do our scans, and then go home back to Calgary. It usually takes, the appointment itself takes an hour to an hour and a half, but it's a 2-day adventure. When they come back from the ISS, usually they're there for about 6 months, we scan them again within about 2 weeks of their return. And then we want to monitor their recovery. So the terms we use are R+0, that means return plus 0 months, return plus 6 months, and return plus 12 months. So we can actually see how well they recover back on Earth. So there's the in-flight phase, and then there's the post-flight phase. And I'm going to focus mostly on the in-flight phase. So as I said, there's 17 crew members. I think I mentioned that earlier, that were involved in the study. On average, they're about 47 years old. There were only 3 women amongst the 17. That proportion is actually changing pretty quickly. And typically the women are younger than the men. The men tend to be more in their 40s to 50s and the women more in their 30s to 40s. And they spend on average anywhere between 4 to 7 months. I've kind of termed it as 6 months, but there's actually quite a bit of variation. And that actually worked in our favor to understand more about bone loss. And it's been really a fun project. So this is an example. We actually had to fly to the Netherlands to meet Thomas Pesquet here, who is a French astronaut, and working with Laurence Vico, another French person. And so Joep van den Berg in the Netherlands had a scanner that we could borrow for this. And so it's just kind of a neat project in its own, just to be able to travel and meet these people around the world doing the project. So a little bit of results. When you look at somebody's bones, we can divide it up into those different parts, the spongy part and the cortical bone. And we found on average in the tibia, we would find there was about a 1.5% decrease in bone mineral density in the cortex. The trabecular BMD would be a little bit lower. In total, the total BMD loss is about 3%. And there's some changes to the trabecular structure and ultimately some changes in bone strength. But really, these are small numbers and people kind of shrug their shoulders and go, so what? So I try to give it a little context here. These lines here represent a population-based study where the black line in the middle represents the average bone mineral density of a 20-year-old, 30-year-old, 40-year-old, 50-year-old, etc. So you can kind of see the slow decline across the lifespan of bone density. And then these parallel lines are the percentile, the range of percentile changes at each of those age groups. So most people follow this 50th percentile line, but you have some, of course, people who are on the extremes. So if you just use the average percentile change and you took a 40-year-old astronaut, let's look at what a 3% decrease in BMD would be. So a 3% BMD decrease along this line would be the equivalent of about 20 years. So in the time period that they're in space, they had that 3% decrease. So one of the things we comment on is within a 6-month time period, they have aged in terms of their bones by about 20 years. And that's pretty strong and something you want to be cautious about. So let me see. I'm gonna try to adjust this on the fly because I don't want to get too deep into the data a bit, especially trying to be mindful of time. But what I show here, I'm gonna talk a little bit of generalities. I said that people were on the ISS for between 4 to 7 months. What we ended up doing is dividing our group into half the astronauts who were there at 6 months or less, and then the other half who were there for longer than 6 months. So 6 months isn't halfway between 4 and 7 months, but it's halfway, it's the median time that an astronaut spent on the ISS. And so the black triangles here show the percent change. 0 would be no change. So some people actually have very small increases, I mean. These are actually probably artifacts. The black triangles represent people who spent less time on the ISS, and the red dots are people spent more time. And there's a bit of overlap. There's somebody here spent less than 6 months, but actually had quite a lot of bone loss. But on average, the red dots, you can see more bone loss than the black triangles. And so in terms of responding, it's interesting because these are the people here that we really don't want. You don't want to be in this category. Very high percent bone loss. I said on average it was around 3%, but some people lost between 7 to 8%. That's very, very high loss. You want to be more like these people. I mean, being up there for less time might help you get there, but maybe there are other strategies as well. And then, there's everybody in between. So we were able to show that the longer you spent in space, so this is measured in months, the more you lose bone. And so that's that negative slope. The longer you spend in space, the further down the slope relative to no change you get. And so it's a concern though, because if we see this kind of trend, what does it mean that's going to happen for somebody who doesn't spend 6 months in the ISS, but spends 12 months or travels to Mars? And I said 14 months, but that's the bare minimum. They're talking more like 2 years missions and things like that. So it's really a long time. And so that was for the tibia. And what's kind of interesting, so this is down at the weight bearing site. If you compare that to the radius actually changes very little. And one of the reasons people think that happens is day-to-day loading. When we're walking around all the time, we're of course loading up the bones in our ankles, and we are using our wrists for tasks during the day. Well, on the ISS, you don't use your ankles at all. You're never loaded except when you're doing these exercises, but you actually use your forearms a lot. And that's how they navigate around the cabin, around the capsule. And so day to day, so we think that might be the reason why it's a little bit more protected from bone loss because of their use. But as I talked about countermeasures before, they try to use countermeasures to prevent this bone loss. So this is astronaut Victor Glover. And this is, let me see if I can get this going. This is using the ARED device, and it's just kind of a neat video to get a feeling of what's going on. So he's up in the ISS and he's doing deadlifts. And so using this kind of loading, he can be helping maintain his bone mass. And what's kind of fun about exercising in space is you stop doing your exercise and then you can just do a little backwards flip if you're bored, and then go on to the next exercise, which I think would be really fun, but I haven't had the chance. So that's the ARED device. And so this is another astronaut using the same device up in space. And so you can also use a cycling ergometer. What's interesting about the cycling ergometer is there's actually no seat. There's no need to have a seat. So this is Chris Hadfield. He's just strapped to the back so that he won't slide off the back, and he spins his legs and gets good cardiovascular exercise. And then this is Jessica Muir standing on the treadmill. She's being held down by elastics to give her simulated gravity while running on the treadmill. And so these are very different activities. The ARED is all about loading your joints, doing deadlifts. This is more about cardiovascular work. It actually doesn't load the joints too much, riding a bicycle, but it's good for cardiovascular. And the treadmill does both. You know, you're getting that impact loading from running, and as well cardiovascular exercise. I've heard that it's very difficult to do though. This treadmill is actually too short for, I mean, she's probably not a tall woman. I don't know how tall she is, but if you take a taller person who has a longer stride, it's kind of hard to run on that. So the issue though is that, and one of the things we've discovered, some of the wording down here, I'll just paraphrase for you, is that people who do a lot of exercise on Earth, these are very highly successful people, these astronauts, and very motivated. They're active. A lot of them do very intense sports. What happens is on the ISS, it's actually very difficult to do that exercise. It's a pain. You imagine they're up there for 6 months and they can't have a shower like we would have and things like that. But they really are trying to do exercise every day. So it makes it very difficult. And so if you have this sudden reduction in exercise, it actually could lead to more bone loss. And ironically, people who don't do so much exercise on Earth might be inadvertently protected a bit from that bone loss. And so the other issue is that the devices that have been placed up there in space so far are still not really hitting the mark in terms of what they need to for bone loss. So the ARED device, you're still getting closer to about 50% of body mass, equivalent body weight, whereas you really want to get closer to 100% of your body mass equivalent up in space to get that adequate loading. And the amount of time you spend in the ISS weightless means that for the amount of exercise you do, which is, can be substantial, they can book up to 2 to 2.5 hours for their exercise. Still, they're unloaded for 94% of the day. Versus on Earth, on average, people are unloaded for maybe 60% of the day. So it's really hard to make all that up by doing exercise. And also, as I already alluded to, it's inconvenient to do exercise up there. You can't get yourself clean after it, or it's harder to. And it takes a lot of setup and takedown. A lot of these devices are packed away. They come unpacked, they do their exercise, and they pack them away again. And so they say that on average, in a 2.5 hour exercise period, they actually only get 43 minutes or so of exercise. So people have looked at other ways they can try to prevent bone loss. One of the ideas that they've been exploring is hopping, getting people to hop up and down. And so by hopping, you get ground reaction forces that are higher. And they've shown that in bed rest studies. not obviously, but often bed rest studies are used as a surrogate for spaceflight studies. They literally will have people sitting in bed for, in this case here, 60 days, reading books and watching TV, I guess, but never getting out of bed. And using that as a surrogate to make it equivalent to, or as close as they can to microgravity, they can test these devices. And so a device like this where you can hop on the plate and so on might be useful. But there's some practical challenges too. And a device like this that would create these impact loads, it has to be isolated from the rest of the ISS some way so that they don't impart that load onto the ISS itself. So there's quite a bit of challenges, and they also have limited space. So you have to be able to keep things in a small area. There is a lot of, I'm just gonna look here to make sure I'm, yeah, so I will comment on this quickly with exercise and bone loss. So this is showing that people who had a pre-flight volume, so before they flew, they did a lot of running. So people on this end of the scale were actually the ones who lost more bone. So this is a change in bone. So the people who, this is a little bit counterintuitive, they ran a lot, but before they went to the ISS, but they ended up losing bone. And this is in terms of BMD, this is in terms of the thickness of the trabeculae, et cetera, showing the same thing. So it really shows that change in exercise, not being able to maintain that running load in space, doesn't work out very well for them. And so one of the issues is trying to find an exercise program that would work for the long term. The other one is showing here is people who did a lot of loading, like the heel raises, they would use the ARED system for that. The people who increased the amount of loading that they did in space compared to what they had done on Earth were actually the ones who reduced the amount of the bone they lost as well. So again, giving hope that these kinds of exercises can help reduce the bone loss, but aren't complete, okay? These are all exercise countermeasures. The other one that I mentioned before is to use a bisphosphonate, the same drugs you would have if you had osteoporosis on Earth. And I'm just gonna skip this part, just showing how our data relates to others. But this data here comes from Jean Sabonga, the woman I showed at the beginning, who's been doing this kind of research for quite a long time at NASA, showed that it's hard to see here, but 0 is the 0 change in bone. These people here showing the median change, all lost bone. They were up in space before they had the ARED system available to them. I think the ARED system came in around 2013 or so. And once the ARED system was in place, the average increased a bit. So they still lost bone, but not as much bone as before. So it meant the exercise was helping. But then when you combine that with the actual alendronate, or the drug for osteoporosis, and gave that to the astronauts, it actually brought it pretty close, a median at least, of 0 bone loss. There's still some variation, but on a median value. So maybe it's drugs are the way to resolve this as well, in combination with exercise. So this is sort of the conclusion of this part, and I've just got a couple more slides. But there is a strong relationship between mission duration and how much bone you lose. The reduction in bone that we saw was similar to what's been shown before in cosmonauts, and then we were able to extend that by looking at bone strength and other issues. I didn't show these data, but bone turnover, so those the cells that eat the bone versus the cells that form new bone, the osteoclasts and osteoblasts, people who had a high rate of turnover were actually the ones who seemed to lose more bone than others. And that exercise can play a role in identifying, first of all, those who might lose bone by having changes in exercise, but it's also an important thing. And then the fifth conclusion was there are really good donuts nearby Houston there. I don't know if you've ever seen this on any movies and stuff like that, but this is sort of the classic astronaut place to go buy donuts. So it's fun for us on our visits. So the last part I was just going to touch on is the recovery part. Incidentally, when you go to Houston, to the Johnson Space Center, it's like a university campus, but it's a very secured campus. You go through security gates to get on and off the campus. So what they do is they leave bicycles all over the campus, and you can just jump on a bike and ride anywhere within JSC, which has been really, it's kind of fun, and it's a big campus, so it helps to get around. So that was the in-flight portion, and then the post-flight is about recovery. And so this is, I was alluding to this a bit at the beginning. This is an astronaut who has just returned from space. And so I think it's within a day or two of his return from spending 6 months in the ISS. And you can see it's quite an adaptation to be able to come back to Earth. And his balance and so on will improve rapidly as he gets accustomed to Earth again. But it'll take a little bit longer for his bones to recover. So I promise just one graph here. But again, this is showing pre-flight versus return. So this phase of the flight here is showing the bone loss that happens for each of the astronauts. And you can see there's a varying amount, but they're all losing bone. There's one exception here, somebody who's basically got no change in bone, but within the spaceflight time. But then upon return, so the return and for 6 and then 12 months, they still don't make it back to that 0 point here. So there's a sustained loss of bone even after 12 months. And if we separate the people into the people who spent less than 6 months, that's the black line here, those ones actually do recover pretty well, but it's the ones who are spending longer in space that don't seem to be recovering. And so we're really interested in looking at that longer term. Fun pictures to throw in the middle here. But visiting JSC, you get to go, and there's a building there called Building 9. They're not very creative with their building numbers there. Our building that we do our measurements is Building 49, but Building 9 is where they have all the prototypes and all the old artifacts from previous missions. So it's a really fun place to take a poke around and see what's going on. So last slide here. That study is done. Then we're just in the process of publishing the last bits about it. We're about to start a new study called, it's like T-Bone, it has a fancy name. This one's called CIPHER, which stands for Complement of Integrated Protocols for Human Exploration Research. And the goal is NASA has organized 17 different studies to be implemented on the same astronauts that will study every aspect of their health: cognition, optical effects, neurovestibular, we're just looking at balance there, cardiovascular, etc. Bone and muscle is my area that I'm interested in. We're one of those 17 studies that are going to be happening. And the goal of this is to understand not just what happens in spaceflight after 6 months, but if we can see if what happens at 6 months gets worse with 12 months, or maybe it stabilizes, we don't know. And that's the goal of the next phase of the study. So with that, that's my final slide, and I'm happy to take questions. And I want to explain this picture too. In the middle here, this is a patch, and it's called a mission patch. And I actually have the patch here. And every time you do a project, they get to be called missions, which I was a little surprised. I didn't realize I was involved in a mission. And we make the patch. And David St. Jacques actually brought the patch with him to the ISS, and he took this photograph for us. And this is in the cupola, looking down on Earth and showing our patch floating around in space. So it was really cool to see that as well. So it's a lot of fun and a lot of interesting work to be done there too. So I will end it there, and happy to take some questions.
Well, that's excellent, Steve. Thanks very much. Really fascinating information there. I think for a lot of us on this seminar tonight, it's sad to know that from probably age 30 onwards, our bone masses are starting to decrease. So, and it's like you're suggesting that we probably shouldn't go on the International Space Station.
Yeah, it's all downhill from here.
Yeah. But I do have one question though, and I'm sure others will have questions. So if you eat those donuts, does that do anything? Does it increase or decrease your bone mass? Or have you done any research into that yet?
Well, I don't know. I've done a fair amount of research, and quite honestly, I'm not sure how it affects the bones, but it makes my mental health better in general.
Okay.
So maybe
anyway,
by
we'll open up the floor to anybody else who's got questions. And I think there is a note in the chat. Let me just open it. Oh, it's just somebody saying, thanks, great presentation. Sorry, I thought it might have been a question. Anyway, open the floor to questions.
So, David, why don't I start with a real anal one? There were 14 people in your study, but there's 17 or 16 to 17 data points, some of the graphs. So I wonder what the other three.
No. So I think maybe I maybe didn't explain. There were 17 people in the study. 14
Okay.
of them were men, and 3 of them were women.
Ah,
Yeah. So
yeah,
and I think I was mentioning at the beginning before the talk started that NASA is very careful about identification of people. And we at first, of course, everybody asks this because typically osteoporosis is a disease identified primarily with women.
right.
It is actually quite prevalent in men as well, but everybody thinks of it as a female disease. And so everybody asks, are the women affected differently by space flight than the men? And we actually have done some of that analysis, but we weren't allowed to publish it. And the reason was that there were only 3 women. And if we identified the bone changes in those 3 women, people could easily figure out which 3 they were by just
Right.
using Google. So,
Oh,
so
boy.
it's a little crazy to not be able to show that. So, but
Could I have one other question, and that would it be possible to go external to the ISS and say create a centrifuge where you could increase the acceleration forces and sort of try to recreate the gravity?
yeah, I mean that's what they show in the sci-fi movies too, right?
Well,
Artificial
I don't know. I
gravity,
don't watch sci-fi movies, but
but
might it work?
well, it might work. I think it's just a practical thing to build something that would work, that could be done like that in space. It's just such a challenging place to build anything.
Right.
So it would help, I would imagine. It would, by simulating the gravity, you would definitely need a fairly large ring to do that in,
Right.
much bigger than what's available right now on ISS.
Okay. Thank you.
But yeah, lots of people have pondered, are there better ways of loading people's bodies in space? That would help a lot. So
Steve, I've just got a couple of questions. One is with respect to the duration in space, and you alluded to it with, travel to Mars might well be a 2-year venture versus the average being 6 months in the ISS. Would you anticipate the bone loss to sort of be almost linear with time, or is there a flattening off because you get accustomed to the environment of space? That was one. And then the second part of the question is just related to recovery, and that is during recovery, is there a difference between sort of continuous loading versus high loading for a short duration? So those are the 2 questions.
yeah, so the first one about long duration spaceflight. So yeah, that is the question. Is the amount of bone loss linearly related to the time and space? And so the window that we were looking at was only 4 to 7 months, and we showed a linear effect in that change. I showed a line there somewhere about how it fits. It's never a perfect fit, but it's reasonably linear. If that were linear and it were extended to 12 months, that would be a big problem. And it's extended to 24 months. I think it's unlikely. I think it has to hit a plateau at some time, but we have to show that. And so that's the whole point of that last study that's about to start, called Cypher, is to at least extend it to 1 year. And it used to be that 1-year missions on the ISS were rare, and it's becoming more and more common. If I was going to space, I'd be happy to go for a week, maybe 2, but 1 year, no, thank you. Like you're running around in a little tin can with a lot of other people in close quarters, breathing recycled air. I'm not sure that'd be my idea of fun. And the other one was recovery. So there are different kinds of exercises, and different exercises have different effects. People who rode the bike like crazy weren't protected from bone loss. They might have great cardiovascular system, but they weren't protected from bone loss. People who are running or doing weightlifting are more protected from bone loss. And on Earth, running as well is a good exercise. that impact loading, just the vibrations of that impact can actually have a pretty strong stimulus to maintain your bones. Bicycle riding is excellent. I do a ton of it. Bicycle, it's an excellent way of getting exercise, but it's actually not the most bone stimulating way. Swimming is even, of course, worse, not really loading your joints at all. But in the grand scheme of things, you should do the sport you like. So yeah. But that's often why, if you go to an Osteoporosis Canada website, they recommend simply walking is a really good exercise for maintaining bone mass. So
Thanks.
Yeah.
So I'm sure there's some other questions out there. So I just encourage people to jump in and
I see Leo has his hand up, virtual hand up.
Yes, a friend's daughter suddenly found that she was breaking bones for no particular reason, particularly ribs and things. And anyway, she's undergoing some treatment where I understand she gets periodical injections for this. But have this been tried out on any of the astronauts to try and help them in their bone loss or bone strength, I mean?
Yeah, I mean, that's a really like an idea that people have been considering. So your daughter's friend, but the person you're talking about is probably there are different classes of osteoporosis drugs out there. And the most common one is called a bisphosphonate. And so people who have had osteoporosis treatments would often take something called alendronate or other similar things. It sounds like what the person you're talking about is taking is a newer drug that actually can build bone, which has been pretty exciting, I think, actually. So hopefully that helps her. For astronauts, these are a fit 40-year-old or something like that. And while taking those drugs might prevent their bone loss, they often, even though they're losing a substantial amount of bone, you can afford to lose a fair amount before you get into that window of fragility. And so they kind of balance it with, sure, I'm losing some bone, but I'm probably not going to break my bones yet. And I don't really know if I want to take an anti-osteoporosis medication that has side effects. So it has been done. I showed some data there where people were actually given it experimentally, but it hasn't really been taken up as a countermeasure for spaceflight yet. It's interesting. These astronauts, I mean, this should be obvious, but they're people at the end of the day, and they are totally it's at their discretion what research to get involved in. So we, as a researcher, there might be 30 research studies going on simultaneously. We do what's called a pitch to them. Informed consent briefing is what they call it. And we sit in a room and we say why you should do our research. And they say yes or no. And so, yeah, so they have a lot of choice in what they do. Typically, they realize that it's it's a very valuable opportunity to do research. So most of them say yes to as many things as possible, but they're not willing to do anything for it. And so if some of them don't feel the value of taking a bisphosphonate, they might not do it. So I see there's an email, or sorry, a chat question there too.
Yes,
vitamin D
Arun
and vitamin
Kumar
K.
has a question there. It's maybe easy if you just quickly read it.
Yeah, so the question is about vitamin D, using vitamin D and vitamin K supplements or other supplements with helping with bone mineral density. So I can't speak too much about vitamin K. I know it's been, there's a lot of interest in that in preventing bone changes, but we actually did a study in Calgary recently, a vitamin D study. And what we were interested in exploring was, we know vitamin D is important to bone health. If you don't have a minimum amount of vitamin D, if you're insufficient, it can actually lead to poor bone quality. And in the extreme form, you can, yeah, so it can be severe if you're really deficient. In Calgary, we typically don't get as much sunlight as other parts of the world just because of our northern latitude and the fact that we cover ourselves up with clothes all the time and stuff. And so vitamin D through sunlight is somewhat limited, but we get quite a bit through nutrition. The food we eat is often fortified. But there's a common misconception, or at least there are many people who believe they hear vitamin D is good for your bones, so more vitamin D is better for your bones. And that's what we were kind of exploring in this study. And so some people take a typical amount of vitamin D you might take on a daily basis, recommended by Osteoporosis Canada or something, would be 600 units per day or 800 units per day on that order. Some people take 4,000 units per day. It's not completely unusual, but it's quite a bit of vitamin D. And there are others who even advocate taking higher doses. So we did a study where we compared 400 units per day versus 4,000 units per day versus 10,000 units of vitamin D per day. That's a huge dose of vitamin D. And we did it for 3 years. And volunteers took those doses every day for 3 years. And actually we showed that the people who took the highest dose lost more bone than the people who took the low dose. So our conclusion was you definitely need vitamin D, but take enough of it. You don't have to go and be excessive about it. So that was our sort of conclusion. Vitamin K, I don't know as much about. I'm sure it's similar to vitamin D where you have to have sufficient amounts, but I'm not sure by taking huge amounts would actually benefit you more. The work I do, I'm a biomedical engineer, so I'm an engineer at the end of the day, and I sort of learn about this, but I'm not treating anybody. I work with endocrinologists who do treat people, and they're the ones who are more the experts in these kinds of areas.
Dr. Boyd, at the very start of your presentation, you showed a skeletal form, and did it indicate that one part of the body actually increased its bone density, and that was the skull?
Yeah, that's good catch.
How would that? Well, that would mean you become more boneheaded, I suppose, the
Yeah.
longer you want to be up there. But could that be attributable to blood flow?
I think that's probably the case. In microgravity, you've got this shift in the blood, the fluid flow and fluid pressure in your body.
Mm-hmm.
In a gravity environment, you've got this gradient of pressure on when you're standing. And so I think they attribute that to increased pressure in the head and that there's some adaptation of the bone in that area. So that could be the rationale for it. There are other, that blood pressure shift has also been implicated in people who have eyesight problems. Some people have had significant eyesight problems as a result of space flight. And so again, maybe it's the pressure that's causing that. That we need to build that spinning ring as somebody was proposing.
Well, thank you.
Yeah.
But you get a bonehead to build the ring, that's for sure.
Yeah. Yeah, working in bone, we get to make lots of puns. Just try to keep things like bare bones and stuff, right? So we have a lot of fun. Yeah.
No problem.
Yeah.
Okay.
Anyway, it'll be very interesting in the next little while. And I don't know if anybody read the newspaper this morning. There was an article in the Globe and Mail about the Russian space program and the ISS. And I guess the head of the Russian space program is very angry at the Western countries for all the things that, I guess, what's going on in Ukraine and the response. And he made a bonehead remark, a crazy remark that maybe the Russians would deorbit the ISS. It was in the Globe and Mail this morning. And that would just be absolutely nuts. So yeah. Who knows? And there's going to be interesting in the next week, actually, because there's an American up there right now, Mark Vandehei, who will be returning with 2 Russians in an ISS, in a Soyuz capsule into Kazakhstan. They have no choice. That's where they have to go. And I think NASA is trying to figure out how to get them out of Kazakhstan with all the other constraints that are going on right now related to airspace restrictions and so on. So it's an interesting time for the space program. Hopefully it comes through it okay.
I think there was one extra question related to vitamin D from Gobin about venom. I think you may have.
Oh, what's the right amount of vitamin D to take? Yeah, seeing a GP will give you good advice, but if you want to look it up, go to the Osteoporosis Canada website. I think it's just called osteoporosis.ca, but you can Google it. And I think they have recommended a daily dose of vitamin D there. Off the top of my head, under the age of 70, it might be 600 units or 8, I can't remember. And over age of 70, it increases slightly, but it's still, 800 to 1,000 units or something on that order. I always forget the exact numbers. So.
Can I ask you, that'll be a last question from me, that's for sure. In your finite element modeling, how do you get the constitutive properties of the cortical and the trabecula? Because they'd be quite different, right? Yeah,
well, it is and it isn't different. So when you look at the bone at a scale at a more coarse scale, then the spongy bone, the trabecular bone, is of course lower modulus than the cortical bone, the dense bone, right? And that's what you're referring to, I think. When we do it at high resolution, we actually see the individual trabecular struts, like all these rods and plates that are interconnected to make a spongy bone. And the element that we use in the finite element is, 60 micrometers cubed. And so those elements that make up the trabecular bone are of the same type of bone tissue that make up the cortical bone. It's just that their elements are more widely spaced, or like the trabecular struts. And so we actually use the same modulus for the tissue that defines the trabecular bone as the tissue that defines the cortical bone. And the main difference is the structure of the bone.
And the stiffness then would be different.
Yeah, ultimately it leads to different stiffness for sure. So,
and you don't try to model that externally and then calibrate your stiffnesses?
Well, we can do that a bit. It's the only way that we've been able to well, there have been a few other ways that have been considered, but the main way you would calibrate it is you would actually take the same bone that you're going to crush, and you would in the finite element model, and you actually crush it.
Right.
But there's not very many volunteers for those experiments. So we do it in, cadaveric tissue and things like that. And once we get a good handle on a reasonable estimate of tissue modulus of bone, then we use that in our in vivo model. So we make some assumptions, and we know that they're not perfect, but they do a pretty good job.
Would animal bones be very different?
Yeah, depending on the animal, it could be.
Would be? Okay.
Yeah. There's a fair, so the tissue modulus of bone tissue is somewhere on the order between 6 to 10 gigapascals. So, and we know whatever we choose, it'll be wrong, but we know it's within the right, it's bracketed within a reasonable estimate. And so it helps when we measure, say, the bone strength of an astronaut before and after space flight, and they've lost bone. What's changed about their bone is not the tissue modulus of the tissue. What's changed is the structure. And so we can assume, even if we have the wrong tissue modulus before and after, the difference in strength will be due to the structure, not the modulus of the tissue. So.
Gotcha. Thank you.
Yeah. And I see there's somebody taking higher dose. There was a study done on vitamin D depletion in submarine crew. Dose levels depend on size, color of skin, many other individual factors. That's absolutely true. Yeah. And that's too complex to suggest one number to suit everyone. I totally agree with that too. So Osteoporosis Canada will have a recommendation, and that's what it is a recommendation. And it's, I don't even know exactly what they're assuming. 6 foot tall white male, I don't know. But it does make a difference how big you are too. But the difference between 400 units and 10,000 units is a bigger difference than it would be depending on skin color and size and things like that. So anyways.
Okay, well, I think thanks very much, Steve. That's, as I said earlier, it's fascinating information, and we'll all see you on the International Space Station shortly then.
Well, you can actually get there now if you have an extra $1 billion or so, whatever it is. Not billion, I don't think. I think you just need I think the cost of a flight is somewhere around 80 million.
Okay,
Like that.
yeah, I can see there'll be a lot of people in the lineup for that one. Yeah. Okay, if there's no more questions, then thank you very much, everybody. And good night.
Thanks very much.
Yes,
Thank you.
thanks.
Good night. Thanks again.
Thanks very
So
much.
Thank you.
Appreciate it.
stay safe, everybody.